This is a COVID-19 infection control training module. A COVID-19 healthcare WHO standard-based module produced by Debonair Training. Specifically for all healthcare workers, medical doctors and nurses, laboratory technicians, cleaning, delivery, care homes and personal home care. You can use the bottom play bar to control the slides and navigation through this module if you get stuck on any slide. Alternatively, use the next highlighted table of content menu clickable from top left. Note: this training module is best viewed with a laptop or desktop screen size, while it can be viewed with a mobile device. For the best mobile learning experience, please download our mobile app. This is where most infections enter our hospital. People come in and out of the reception area every day. Community spread of COVID-19 pandemic starts in public places just like this. My name is Adesuwa and I am an expert in hospital reception hygiene. I have been sent here to deliver critical compulsory training for all healthcare workers in this facility. There is no room for errors here, so your full unhindered attention is required. The topics we are going to cover are: introduction exercise of social distancing to flatten the curve, hand washing and hand sanitizer application, face masks, types, usage, cleaning and homemade masks with video, healthcare staff protection, cleaning and facility hygiene, crash course on COVID-19, and exercises testing your competency in preventing community spread. Click the forward arrow to continue. Now, click Apply It to explore the reception area and decide how to handle potential COVID-19 infection risks and prevent community spread. Later on you will click on Learn It for a brief study of COVID-19 coronavirus and the key principles of successful hygiene. Now, click the button directing you to the hospital ward. What do you have to do here to reduce the COVID-19 infection risk to flatten the curve? Select one or more options below and click Submit. Great answer. Social distancing of at least 2 meters from people not members of your household, the same length of a normal adult bed or house door, along with thorough frequent hand washing. Hand washing for a minimum of 20 seconds. Upon contact with outside objects, long enough to sing Happy Birthday song twice. Click the forward arrow to continue. Summary of Part 1. So far we have covered the 1 point as an introduction to the course. Social distancing scenario exercise to flatten the curve. The topics we will cover in the next parts are: a brief course on COVID-19, preparing you for exercises testing your competency in preventing community spread, healthcare staff protection, cleaning and facility hygiene, hand washing and hand sanitizer application, face masks, wearing PPE, usage, cleaning and video of homemade quality masks. Click the forward arrow to decide the way you want to proceed through the rest of the course. If you're viewing this infection control simulation via Debonair YouTube channel, click on COVID-19 Training for Healthcare Part 2 to continue. To interact directly with the training module, click on the link in the YouTube video description. If asked to sign in, you may sign in as a guest. For more incisive training slides, to expedite the end of this global pandemic, and to minimize the damage to our health and economy, you may contact Debonair Training Limited using the following details. Click the next forward arrow for Part 2.